Cold weather usually means cold and flu season. Hopefully you've had your flu shot, but that doesn't guarantee you won't be feeling run down this time of year. As Rod Starnes shows us in our cover story, there are plenty of bugs, other than the flu, that can really bug us this season.
Contrary to what some believe, cold weather doesn't cause sickness, but it can remove moisture from our airways, making us more susceptible to infection. Plus, being inside more during these chilly months means we're all getting a lot closer. Now, most of us were taught to share when we were younger, but sharing sickness? That we can do without. Once someone is sick, influenza often comes to mind, but doctors are seeing a lot more than the flu in the winter months.
Some of the other common ailments we see during the winter months are the common cold, sinusitis, bronchitis, strep throat, and pneumonia.
Okay, you're sick, but let's not jump to the worst conclusion first. You could just have a common cold, cough, congestion, runny nose, about a week to a week and a half of not feeling well. But you can treat the symptoms on your own. Cough suppressants and decongestants will help you feel better, and a pain reliever will help you get rid of those body aches or a low-grade fever. And believe it or not, Mom was right about the benefits of good old chicken noodle soup.
They haven't quite broken it down to find out what specific things in the chicken noodle soup is helpful, but there is clinical evidence to point to chicken noodle soup being effective.
Score one for Dr. Mom. But if that cold lasts longer than a week or 10 days, or your symptoms include a high fever, shortness of breath, or chest pain, it's time to see a real doctor.
Good afternoon, Miss Duggar. How are you doing today?
Oh, I'm not feeling good.
Oh, I'm sorry to hear that.
One winter ailment that crops up is sinusitis, a secondary bacterial infection in the sinus cavities that can cause a lot of postnasal drainage, headache, and fever. Bronchitis is another nasty infection characterized by a prolonged cough. Or you could develop strep throat. What that infection lacks in nasal stuffiness, it more than makes up for with a severe sore throat. Don't try to take care of any of these symptoms yourself. Get to a minor med or your doctor. More than likely, he or she will prescribe antibiotics, fluids, and bed rest to get you on the road to recovery. Keep in mind, if you ignore this advice, you could be setting yourself up for a serious sickness, pneumonia.
That's a lower respiratory tract infection. It tends to be a little bit more serious than the sinusitis and the bronchitis. A lot of times we do, though, treat pneumonia on an outpatient basis, but in some patients it can be serious enough where they'll have to be hospitalized. Ms. Mason, why don't you have a seat for me? How are you doing today?
Linda Mason wasn't taking any chances with her symptoms, and she wasn't wasting any time getting to the doctor once her cold-like symptoms changed from bad to worse.
Body was aching, fever 102.2. I just couldn't raise my head up. I thought, it's time to go. This is serious.
Her doctor diagnosed Linda with pneumonia, thankfully before any acute symptoms developed. Like any good patient, Linda is following her doctor's orders to the letter.
Stay at home. Plenty of fluids, soup, water, juices, and rest.
If you happen to get sick, the advice to stay home from work or school is nothing to sneeze at. Passing your illness to coworkers or classmates is not only unpleasant for them, it could lead to some serious consequences.
Because other people with more serious chronic illnesses such as lung disease and asthma, they can really be affected by a common cold and have more serious complications such as pneumonia.
Linda took the time off she needed, and 2 weeks into treatment, she's on the mend.
Good, you sound much better.
Now she's ready to head back to work and leave her winter ailment behind. For Smart Medicine, I'm Rod Starnes.
Joining me now is urgent care physician Dr. Todd Robinson. Dr. Robinson, thank you so much for joining us.
Well, thank you, my pleasure.
Tell me some of the things we can do to ward off winter illnesses.
Really just common sense stuff. What most people don't really actually follow through is drinking plenty of fluids, getting plenty of rest, and then the most important thing is really your diet as far as fruits and vegetables, which a lot of patients unfortunately don't do.
And washing hands, I'm sure. that soap and water.
Okay, sneezing into your hand, like Kleenex, washing hands frequently, of course, cleaning off surfaces like phones or keyboards in which people touch a lot when they're sneezing. So just really common sense things which a lot of patients don't take in advance as far as doing. And then, of course, there are different medicines and over-the-counter
I was
stuff.
going to say, what are some of those over-the-counter
Well,
medications that can help ward off illnesses?
The only proven one, and it's still sketchy, but the proven one is something called Cold-Ease that patients love to talk about. It's basically zinc tablets, and it's lozenges, and supposedly it's supposed to prevent infection. They've done some couple studies that showed it did prevent colds or it lessened the healing time, but there's also a few studies that showed it didn't do anything. So
it's kind of like take it if you want to.
right, it won't cause any damage or anything to it. So.
What are some of the things we should avoid doing?
Basically, most people do not get enough rest, don't eat the proper the fluids and things like that, and those are really the big things as far as during the cold and flu season, that they don't do the things that actually will improve their immune system and preventing the infections. The basics are really is the best way to go.
No, we saw chicken soup is great.
Oh, yes, it is. It actually is. The chicken soup, the rest, it's good for the fluids, has some nutrients and things like that. We don't know exactly how it causes and improves it, but we know it does help.
Dr. Robinson, thanks so much for joining us.
Well, thank you very much.